Hello, everyone. Thank you for joining us. Today, we're going to talk about adaptive tools that you can use to make your day to day tasks a little easier. Here with me, I have one of our occupational therapists, and I'm going to ask him to introduce himself.
Hi, my name is Paul Levine. I'm an occupational therapist and I'm a certified hand therapist, and I work here at Valley Medical Center Outpatient Rehabilitation Services.
Excellent. Thank you so much for joining us today, Paul. So, my first question, let's start with the basics. What is an occupational therapist? What do you do?
Well, occupational therapists, we are healthcare professionals, and our training is to assist patients in learning how to be as independent as possible in areas of work, self-care, and leisure. We do that through a variety of methods. Our clients do exercises, we do a lot of education, we teach activity modification, and we also teach folks how to use adaptive aids.
And what is an adaptive device? How can they help?
Well, an adaptive device is any device that can aid a person so that they can live as independently as possible. And they take on many forms.
Okay, last question before we get to the tools themselves. How does someone know if they should seek occupational therapy?
If somebody notices that they are having a decrease in their functional ability to do things, one of the most important things is they make an appointment with their primary care physician. And the reason is you need to know why there is a change. If something is detected early, you have the best chance of turning things around. Another reason is that just having a diagnosis allows you to make better healthcare decisions, just knowing what's going on. Another reason is that when you meet with your healthcare provider, they are going to show you all your options for trying to help your situation get better. Now, if you and your provider decide that you need some additional assistance to maintain your independence or gain further independence, then your provider would write a referral for occupational therapy, and then we would do an evaluation and figure out how we could best serve you.
Okay, great. I know you've got a lot of awesome things to show us today, so let's break them down into categories. How about we start with things that we know people can benefit from every day, like items that help people bathe and use the restroom?
Bathrooms are a place where a lot of people fall down. So for independence and safety, sometimes we recommend tub transfer benches. Makes it real easy to slide in and out of the shower. Or the bathtub, I should say. Sometimes people that have showers, they just have a chair and they sit, and it conserves energy because they can sit while they shower. A lot of folks find that handheld showers are quite helpful. Okay? Go on easily. Now let's move to the toilet right over here. Toileting can be quite difficult. When your legs are weak, it's very important to have a good set of armrests. These just simply snap onto the back of the toilet and allow you to get on and off, and they're very adjustable.
And what about tools that help people get dressed and take care of their appearance?
Well, there's a lot of tools that we recommend to our clients. It really depends on what their situation is, but here's some of the common ones. This is a reacher. This comes in very handy for folks that have limited mobility, and maybe they drop something on the floor, maybe a sock or something. And then once they actually start the dressing process, we oftentimes recommend these things called dressing sticks, which are terrific for if pushing off of your socks or pulling a shirt out of a closet. Quite helpful. Now here, we also have something it's called a sock aid. Many people have to wear compression socks. They're very expensive, but the biggest problem is most folks can't get them on. They're very tight. So this is a device that you slide the sock over, and then once it's slid over, and it's quite easy to slide over, I simply take my foot, drop it in this device. Got to pull my pant leg up, push, and voila, it's done. And here's the crazy thing. Everybody loves this. So we call this an adaptive toenail clipper. And you know what it is? It's just a regular clipper that somebody screwed down to a board. And now look at this. Let's say I got real painful pinch or weakness. Look at this. I just literally, push, and I can clip my nails, even my toenails.
What about things that help in the kitchen with things like cooking, eating, and drinking?
Well, in the kitchen, one of the biggest complaints we get is folks, they just cannot open up tight jars. It's very difficult, arthritis, you name it. This is something that actually mounts to the bottom of a cabinet. And what happens is it grips. It's got a set of teeth and it grips the jar. So you could do a two-handed untwist. Very helpful. And it's also really good for even smaller bottles with metal caps. Okay, another thing that can be quite helpful is folks oftentimes use Dyson. Okay, it's just very sticky, also called shelf liner, and I'm sure everybody's seen this before. Okay, here's another tool that just came out on the market. I get a lot of patients, they complain that they can't open their water bottles. This is a universal bottle opener, and it actually mounts on the refrigerator. It's got magnets, and you just slide it over, and boom. And this is a brand new water bottle. This has not been, I've not cheated, so it was very easy to take off. Sometimes folks have difficulty eating. Now, this is called a universal cuff. These are quite common for folks that have very, very weak grasps. They come in different forms, but the bottom line is you just slide it over your hand, and it makes it much easier for somebody that has some form of hand deficit. Now, I get a lot of patients with arthritis, and they find it's just very difficult to hold on to a regular eating utensil. It takes a lot more strength. And there's many companies that manufacture these, and they're made of rubber. They go in the dishwasher. They're easy to hold on to, super easy, dishwasher safe. For folks that aren't interested in that, sometimes what I'll do is I just give them what we call cylindrical foam, and we buy this in packages. You can get it online yourself. And so here I am, I got a fork, it's difficult to hold on to, and I simply slide the fork over, and now for a very weak grasp, I've got something that makes it easy to hold on to. There's one more thing I wanted to show you. A lot of patients find this is very helpful. Some folks, they have to use a walker, maybe temporarily or permanently, but just having the ability to carry objects using their walker in a safe manner. This is great. It just drops on your walker. You're in the kitchen, you want to eat with your grandkids or your daughter or whatever, throw your food, transport it on this little tray, cups fit there. It's terrific. And then you just throw it off. So that's another very good thing to help you become more independent and make your house more accessible.
Okay, I know you've got a few more. So, what final common adaptive tools do you have for us?
Well, this is something that is for medications. This is a little gripper that is terrific for unscrewing the caps of your bottles of aspirin or stuff. I failed to bring a bottle with me, our little bottle of aspirin, but you can see how you just slide it over and you turn it. Now, a lot of my patients love this. Another thing that's kind of common sense is just having a lever handle on your door. Okay, I got many patients and they can no longer hold on to a knob. They don't have the grip strength. Or, so if you can go and retrofit your existing door hardware with a lever, or they even have these little universals that you could take with you on a trip if for some reason you needed to modify it in a quick method. Another thing that I find is very interesting is I have a lot of arthritis patients that find it very painful, or their hands go asleep holding onto a steering wheel, and just simply getting a big, larger steering wheel that's padded, absorbs road vibration, easier to hold, less pain for the patient. This is very helpful for folks with carpal tunnel. This holds the wrists in a very neutral position. This is a mouse, okay? It's just, sometimes you have to modify the way that you hold things. And this is just an example of something you could get even at your computer store. I find a lot of patients, they have much difficulty writing. 1 pound of pinch force is a lot of force down here. People get very sore holding pins right at the base of the thumb. This is a larger pin. Larger, you do not have to squeeze it as hard. It's got rubber. The rubber makes it so you don't have to squeeze it as hard. This pen has got gel, so the ink flows out rather than having to push hard on a ballpoint pen. Sometimes what I'll do is I'll go back. Remember we talked about the cylindrical foam? I'll just take a piece of cylindrical foam and I'll slide it over their favorite pen. And folks find that's very helpful. And then last but not least, we have a lot of folks that love to do different hobbies, whether it's crafting or gardening. And we always talk about ergonomics for tools. Hey, great pair of scissors. Look, no pressure on the thumb. It's all in the palm. So it's just an example of some of the things you could use to make your life a little bit easier and make you a little bit more independent.
Wonderful. Thank you so much for sharing your expertise with us today, Paul. For those watching, if you'd like to learn more about outpatient therapy services at Valley, please visit valleymed.org/rehab. Thank you and have a great day.